Hey guys, welcome back to another episode of Nursing Uncharted. Today's guest, I have been waiting for this episode for months. We just couldn't align our schedules for some reason. But without further ado, please welcome my next guest, Everett Moss. Thank you so much for being here.
Hey, happy to be here. You're right, but I guess that's the life of busy people, right? Trying to think schedules.
It's the nursing life, right?
True indeed. True indeed.
Yes. So you have a lot of accomplishments, and I'm going to allow you to introduce what you do, what you've done, and all of those extra special letters after your name.
I guess officially, I am Dr. Everett Moss II. I am a Certified Registered Nurse Anesthetist, CRNA for short, and I have a Doctor of Nursing Practice degree. And additionally, my foundation began in fire and EMS, and currently I still hold my nationally registered paramedic certification as well. So quite a bit of a journey to get where I am today, but in short, that's what I am and that's what I do.
And I love that. I think when I first read your bio, that was something that really stuck out to me is that your journey has been healthcare and, first responding, and you've done so much and you still carry that with you into nursing. And I think it just highlights what nursing is, what nursing can be, and really the journey. And from our first conversation, something that stuck out to me was just, you know, you can do what you want to do, but you have to want to do it. And, you just have to put your mind to it. And I know that's not the exact wordage you used, but that's what I took from your message. And I think that it's really inspiring. So I'm excited to get that out there to the listeners and, maybe inspire some people out there.
Indeed. I mean, that's what it's all about. Initially, we start out helping others, but we are also in it to, help the future to do what it is that we do.
Exactly. Exactly. So going back to where this started, you first, you had just mentioned it, EMS, right? And
Right.
fire. What was
Right.
that journey like? When did that start?
So about 19 years old, I signed on with the City of Atlanta Fire Department. More background to that, my father was a firefighter. So that's how I got exposed or introduced into fire service. And I thought that he did it and made a living and provided for a family doing it. And it was something that caught my interest. Once I got into the industry, it kind of started that initial spark to my passion to help and serve others. And I mean, let's face it, it's a 19-year-old guy. It's kind of cool to be a firefighter, driving the engines, going on the calls, wearing the turnout gear. I mean, it's cool. Like, let's face it, like it is what it
Call
is.
it for what it is, right?
Right.
Oh,
So
I
yeah,
love that.
that was a start. That was a start, and from there it moved to flight medicine, which again, let's face it, it's kind of cool to work on a helicopter. You know what I mean? And
It is.
if you've ever been in the ER or on the highway and you see the helicopter land, or you see the people come in with these adult onesies on, and everybody's like, "Oh, it's the flight crew," So that's my background, but both very needed and
Mhm.
important professions.
Yeah, very much so. Oh my gosh, you just literally I'm sorry to, like, deviate for a second, but I used to do NICU transport. I don't know if we talked about that,
Huh.
and I tell you what, there is just something special about being in a helicopter, and one of my first episodes, I was actually with a flight nurse, like, he was a friend of mine, and I'm like, "Please come on and be my guest,"
Mhm.
and it's a family, like, that life of, like, fire, EMS, paramedics, flight nurses, it is just a bond because when you're in that helicopter, it's a different life up there, and you have to rely and trust each other.
Yeah,
So
yeah, you're right, because in regular units, you get close, you kinda,
yeah,
work together and have each other's back, but it's a different animal sometimes when your connection comes outside of patient care, where you're having to be concerned about each other's safety, communicate differently,
right.
learn differently, train together, and it definitely makes you a closer knit family.
It does, and, those hot fireproof onesies
Yeah.
are no joke, so oh gosh. So when you were doing the flight portion, was that as a paramedic, or what was your title during that time?
So initially, I started part time while I was still a firefighter paramedic. and I started as a flight paramedic. Of course, along the way and becoming a nurse, I eventually transitioned to title of flight nurse. For the company that I worked for, if you had the necessary credentials for being a flight paramedic and a flight nurse, you could fill both roles.
Oh. Oh, wow. So that and it's I guess it's very state dependent, but I know sometimes, like, paramedics can intubate, whereas, like, nurses, that's really not their scope of practice, so that's kinda cool if that would be, like, a state that you would work, that you can
Yeah,
function in both of those aspects.
well, so you can function as far as skills, right? The company that I work for, state that I worked in, skill wise, we both were credentialed, if you will, to do basically the same skills, regardless of your licensure or certification. When I say that I could fill both roles, basically, if we were short a paramedic that day and I was
Oh,
willing to work, I could work in the medic seat because I held both credentials. But normally, though, my nurse partner, we would switch roles sometimes. I would be the flight nurse for the day in terms of the duties, and they would be the flight paramedic. Now, of course, some weren't as comfortable with the intubations and things like that that they
yeah.
haven't done, but then there were those of had done it for a while and, were comfortable with it, and we roll with it.
Yeah. This just, like, brings that fire back in me, like, it's just so it's so exciting, and, you don't wanna say, "Oh, it was because it's so cool," but, like, you're proud of yourself at the end of the day, and you're, like, strutting your stuff in those onesies because, like, you're saving lives, like,
Yeah, yeah.
legitimately saving the lives,
It's
so
cool.
it is
It's
it
cool.
is cool. It's cool. I sometimes think I'm like, "Man, I wish I would." I'm so specialized with neonates, and I'm like, I wanna go back to the ER, I wanna be a flight nurse," but I'm
Yeah,
like, "Gosh, it would be like starting all over again," but it's so
yeah.
freaking cool.
It is. It is. It really is.
Yeah. So you got your CRNA. How long did you function as a nurse, and did you work in the ER? Like, what was your nursing journey like getting to where you are now?
Okay, so after being on fire service for, I guess, about 9 years is when I decided that I was gonna transition and go back to nursing school. Went to nursing school almost 10 years ago now. Oh, no, 10 years ago now, not almost, over 10 years now.
Yeah. Nice.
And then I started CRNA school almost 5 years ago now, practicing for almost 2 years now. So, my
Okay.
nursing experience prior to CRNA school was about 5 years. It encompassed ER, ICU, peds vascular access, peds and adult ER, as well as some administrative time.
Oh, wow. You're very well-rounded. I'm jealous.
Listen, I tell people when they ask, what made me stand out on my CRNA application, I'm like, you know what? Before I even answer that, I'm not recommending you take that route. And
Yeah.
not that it was a bad route. I mean, it was a lot of years. And
Yeah.
I mean, I don't think you need 15, 16 years in healthcare before you go back to CRNA school. But I am thankful for the experiences and exposures that I've had along the way. And I agree, it does make me more well rounded in the sense of having touched variety of areas. Doesn't necessarily make me a better CRNA, but it definitely makes me one that has been exposed to more things and comfortable in certain situations that
Right.
another might not.
Right, and when you talk I've looked into CRNA school because I think I've really thought about if I ever go back to school, that is something that I am passionate about. I think it's a really amazing opportunity as a nurse to function in that role. A lot of I'm NICU, so it's ICU, but there's only certain schools that allow you to enter into a CRNA program with just it being a neonatal ICU. But I feel like it does make you stand out, and also for future jobs. And, if the hospital is potentially helping you go through schooling to offer you a job, you have the experience in peds, you have the experience in adults, like it versus someone who maybe only worked adult ICU and only has that adult experience. I do think that it makes you well-rounded, and I feel like if I could start my nursing journey over, I would maybe have dabbled in a few other specialties, but I am very grateful for where I am right now, don't get
Mhm.
me wrong.
Right, right, right.
Yeah.
Yeah, no, I totally agree. I totally agree. Dabbling. to me is the best thing about our industry, is that there's a lot of areas to dabble in and find your
Um,
passion, you know?
yeah. Yeah, you really can. Nursing, you can do anything. You can be in the hospital, outside of the hospital, hospice, peds, like, just anything, and there's so many things
Literally.
that yeah, and so I think it's a good degree to have under your belt. My dad always told me this, my dad was my guidance counselor, and he's like, "Just get your nursing degree. You'll get hired anywhere, even if you hate nursing." And I'm like, "Yeah, right." And
Mhm,
now I see it. There's
mhm.
so many opportunities that you have with that degree, and the experience, even if you decide to step away and do something else, you're still a nurse at the end of the day, and you can always
Absolutely,
bring something to the table.
absolutely.
Yeah. What made that jump into, CRNA? What was that drive for you?
I think it was realizing the total package of what a CRNA is and does, and it kind of, was a combination of everything that I had done.
Yeah,
You can intubate, you can put in lines, you can manage a patient from the head of the bed. I mean, because on the
yeah,
helicopter and on the ambulance, that's where you live, at the head of the
at
bed,
the head of the
making
bed, yep.
making decisions,
Yeah,
calling in, additional resources and things of that nature. And it just was a very autonomous role. And I like patient care, and I also like a little. I'm no longer. I don't consider myself an adrenaline junkie anymore. Like, and I don't know if I ever really was. I just was young and I was a guy, so the
yeah,
adrenaline was attractive, but didn't go in seeking that. And now I'm completely okay with calm cases. Like, I do not need a lot of action. But even some of the most basic cases require IV access. They require intubation. They require an epidural, a spinal, or a nerve block. And I like skills, and I hope to become better at skills. No matter how many I do, my goal is to become better. And that was something that was really attractive about the role, and more specific. In the NP profession, there's a lot of variations to what NPs do, and that's why that's a good option for some people, because they want or need that greater variety. I kinda like
yeah,
my anesthesia box, if you will,
mhm,
though it's a very encompassing box because we do a lot, but I kind of have this area that I can specialize in, and I enjoy doing it.
yeah, and it just made me think you also sorry, I didn't even address this, you have your doctorate nurse
Mhm.
practitioner. So
Correct.
when did you have time to do that?
Okay, so no, no, no. So not nurse practitioner, doctorate of
Okay.
nursing practice. So
Practice,
yeah,
okay,
yeah.
okay,
So
got it.
literally just the doctoral degree that a lot of MPs have, and now
Yeah,
is
that's
a
why I got confused.
requirement. Yeah, no, no problem.
Yeah.
It is now. So I mean, that's a great question and something good to answer on this podcast. As of January 2022, the Commission on Accreditation for the CRNA programs require them all to be a doctorate of nursing practice program. So
Okay.
everyone who enrolled, as of January 1, 2022, will graduate with their doctorate in nursing practice.
Oh, wow. Okay. That's amazing.
Mhm. Yeah. Um,
Yeah, and that go
Yeah,
ahead.
that that allows for other opportunities. So if somebody decided that being at the head of the bed is no longer their passion, having that doctoral degree opens up education. It even open up other positions within the healthcare administration team that will
Right.
allow you to branch off into other areas if anesthesia is no longer your main passion. So that's a
Yeah.
huge advantage.
That's a huge point to make. I mean, just talking about working in the hospital and administration, like having your doctorate is, that puts a gold star on any application that you put in there because you can be utilized in so many ways,
Correct.
beyond just the nursing skill aspect. But talking about the skills, it just as a CRNA, that is a very skill driven profession, and I do think that is what is the highlight for me. And I'm thinking and reflecting back, like, I wonder if just, your experience being pre-hospital, like you said, it just like, it keeps you doing that and allows you to be the head of the bed and a decision maker.
Mhm.
Whereas as a nurse in the hospital, you don't usually get that opportunity to do that.
Right. Yeah, there's a lot of variability with nursing depending upon where you work, type of facility, but for the most part, the CRNA functions in that role, whether we're at the smallest surgery center or the biggest hospital. Yes, the practice model changes, but at the end of the day, at some point in time, you're put in that position of leadership
Yeah.
and decision making for better patient outcomes.
Yeah, you're looked at as a leader too as a nurse, and
Absolutely.
that's something with the with my experience, the doctors would always be like, "You're a leader in this unit," and then when you go back to just being, just the nurse that you were before, which is totally fine, it's a crave sometimes for
Mhm,
me, so,
mhm.
yeah.
Understood
Uh,
completely.
so talking about where you work, where do you work? What is your specialty with, everything you do? If I remember correctly, you work a lot of different places, but what is explain that to me again.
So I've always kind of worked a lot of different places, but my primary place of practice is in South Carolina. I work at a level one trauma center as well as a high risk OB. What I
Nice.
primarily do is general and anything that falls into that general bucket. And then the team that I'm on, we actually also primarily do the obstetrics for the hospital.
Okay. And the obstetrics is that
So
kind of a
is
passion?
yeah, yeah. I mean, it is one. I feel like it's a more consistent skill area as far as not in comparison. I'm just saying it's one of the areas that you are doing a skill pretty regular because, labor epidurals, like that's
Yeah,
something if you are in anesthesia, that's something that happens in anesthesia basically every day, unless you have a very, very small labor and delivery department, there's at least an epidural placed on a labor and delivery unit every single day. So that's an attraction for me because I like skills and I also want to be good and become better at the skill. I think the other passion for me is the fact that I personally, not speaking for anyone else, but I, Everett Moss, will never know what it's like to birth a baby. Right. So, that being said, I kind of like being able to provide some type of relief or a positive turn on the labor experience. If
mhm,
I can come in, place a smooth epidural, and now all of a sudden, just like that, mom is comfortable and can focus on the positives of the delivery as opposed to the pain of
yeah,
delivery. That's an attraction for me. The C-section area, being able to come in, place a smooth spinal, mom goes completely numb from, chest level down and be able to have a role in that first experience with their child. Like that just, it does something for me, and I like being
yeah.
able to provide that.
That's so special. That just saying that, like, that's your heart speaking, and that and that's something that with nurses, I just wanna highlight that because as nurses, good nurses, our heart is in it, and, like, that's you can tell just by saying that, like, that's you wanna make that experience special, and, you have children, correct?
Yeah, yeah, I do.
Yeah,
I do.
yeah, okay. And I don't and we can edit this out if it's not okay, but
It's
to
completely
going back to
fine.
that, your son didn't isn't he wanting to get involved in,
Yeah,
like,
so I
how
think
you
when
started?
we met that first time, I'm gonna pause on my end so they can
Sure.
edit this part out because he's actually walking through the door right now.
You can come on and say hi.
I don't think he was. Okay. So yes, my when we had our first meeting, we were actually down in Atlanta to introduce my son to the City of Atlanta Fire Department recruiting process and the things that he has to do to become a City of Atlanta firefighter. So right now, that's something that is on his radar and possibly becoming a third generation firefighter.
Oh. Yeah, how does that make you feel?
I mean,
Excited?
definitely excited about it. My goal for my kids is honestly just for them to find their passion, whatever that looks like, because I know what it feels like to work in areas that you don't want to work and that you don't enjoy. And I also know what it feels
Mhm.
like to work and be doing something that you love doing. You know, we work a large portion of our lives. And I think it is one of the most miserable things in the world to know that someone worked in the area for 20 plus years and they hated every moment of it. You know,
Yeah.
that's heartbreaking to me because I do not want to see them live a life that they have to live as opposed to living a life that they want to live.
That's extremely inspirational, and it's a really I think it's really important to say that you have to love what you do, and I don't know the saying, but, like, you don't know the risks you don't take, or you don't and it's and sometimes you go a path and you're like, "You know what? This just isn't for me." It's okay
Mhm,
to start over or go somewhere else, and going back to how that relates to nursing, you could specialize in ER, you could specialize in geriatrics
mhm,
and be like, "I don't like this," and be 15 years in and start over somewhere. The hospital system I work for now, they have, like, it's basically like a transition of care
mhm.
for nurses,
Right,
and
right,
it brings them in, and you get, like, a seasoned nurse who's been a nurse for 15, 20 years can be like, "No, I wanna try this,"
right.
and that hospital system allows them to go through and get the orientation to start something different. So, I really love that you said that, I love that you pointed that out, that, you should love what you do, not have to, but you should, and there's opportunities to do that, and
Absolutely.
yeah,
Absolutely, and you mentioned something that I said in one of a previous podcasts, and that my path was nonlinear, and that there is
yeah,
a nonlinear path to success, and that, you know, when I left fire service, I tell people I compare it to, you know, being deserted on a boat in the middle of the ocean, and you know that you've been paddling from that direction for however long, and there was nothing back there, so you just keep paddling in the opposite direction, hoping that there's land over there, hoping that it's, you know, food over there, hoping that it's water over there. So when I left fire service, I wasn't certain of where I
yeah.
would be, you know, now 12 years later, but I was hopeful that I would have the same passion for where I land as I did for
Mhm.
fire service because I still to this day, fire service was a true joy to do.
And you can tell that by speaking about it, and I think that saying the nonlinear path is it's that you hit it right on the head there. It's you don't have to do and your path, like, you even we just talked about it. You wouldn't recommend anyone do the path that you did because you had so many different steps along the way, but that's okay if it's not. Like,
Quite okay.
you can you can take a U-turn and start start
Yeah,
over. It's still a path at the end of the day. And
indeed.
I yeah, and I love that. I love your inspiration that you bring about all of nursing and, even just all of medicine, and you kind of put it in this nice wrapped picture to be like, these are options that you have, and you're just so positive about it, and that's something that I'm grateful that our paths crossed, because I think this message is so important to listeners out there, people stuck
Mhm,
in nursing and just not knowing where to turn, and knowing that
absolutely.
there are so many options for you out there.
Tons of options,
Yeah.
like, we think we know how many options there really are between you and I talking about this, but there are
Yeah.
tons more that we haven't even heard of.
Oh, I learn something new and I'm grateful for this podcast because I meet people and I'm like, "Wait, you do what? Like,
Mhm.
wait, how does this work?" And as nurses, we're like, "Yeah, we know our career. We know our career path. We know this," but there's so much that is out there and opportunities for us. So, yeah, I love it.
Absolutely, yeah.
So getting back to the CRNA portion of what you do, because that's something I really want to highlight.
Mhm.
Something you said to me, and I don't want to give this away, but it was like the patient experience for you as a CRNA when you're putting them under. Do you remember what you told me?
Yeah, yeah, so one of the things that I like to say, and it kinda just gets their mind off of the surgery and puts them at a more peaceful, relaxed space. At least that's the goal. Doesn't always
Yeah.
work, but it's the goal. I asked them, you know, "If you could go anywhere in the world, where would you go?" And a lot of times they're totally caught off guard, like, "What?" But so I'll prompt sometimes and say, "Are you a beach person? Are you a mountain person? And if you could go to any beach, any mountain, anywhere in the world, where would you go?" Once they tell me the answer, I say, "Okay, today you get to go there on a first class flight. We're gonna go there, let you hang out, walk around. If you partake, you can have you any cocktail you want. If you don't partake, you can have any mocktails that you want and just enjoy yourself. And when you wake up, you can tell me all about it." The
I love that so much, and it ties your passion back to, like, your because you have that passion for, like, flight, fire, like, all of that, and you found a way to bring it back to your patients now, and I just love it so much.
Yeah, yeah, and then, for me, the real win is when we get out of surgery into the postoperative area, and I say, "How was your trip to so and so?" And they laugh or smile and say, "It was good." That's like the true, "Okay, I'm gonna keep using this."
Yeah,
Because if
you
I
did
can
your
get
job.
yeah, exactly. If I can
Yeah,
get that smile and that recall of that conversation, then to me, that's the part of the surgical experience that they will remember most and that will lessen their anxiety and fear should they ever have to go under again.
yeah, yeah, I love that. I thankfully, I've only gone under once, maybe? I don't know, I had my wisdom teeth out, I was younger, but, like, I haven't recently had to have surgery where I'm put under, but
Yeah.
I pray that if and when I do, I get someone like you because I think that it's terrifying. Like, I
But
was recently a patient and I had conscious sedation in a cath lab,
uh-huh.
and I'm like, "I'm a nurse, I know what to expect, it's gonna be fine," and I get in there and I was terrified. I
Yeah.
was terrified, and then the doctor's like, "You're a nurse, you're good," and I'm just like he's like, "Why are you silent?" I'm like, "I don't know what to say because 'cause I'm gonna
Yeah.
freak out,"
Right, right.
you know,
You
and
know,
just having someone calming.
I'm kinda big on words, and especially the older I get, the more books I read, and, I just realized in this moment in this podcast, I'm gonna stop saying "going under."
Yeah,
Because as I'm hearing you say it and I say it, most of the time when you say "go under," it has a negative tone to it. You know what I mean?
it does.
So
No,
I don't
I mean, you're right, but I never thought about that.
I don't know what I'm gonna change it to, but I think I'm gonna just stop saying it. It's like, and I'm sorry to go off on a tangent, but it's
No,
also
I love
like
it.
when we lose someone or someone loses someone and we say stuff like, "How are you doing?" And it's like, I get why people say it. I totally
Yeah.
get why, but I'm doing horrible.
Yeah.
You know what I mean? And so I
I answer
really
people like that now, though.
okay.
I don't do the sugarcoat because if someone's asking me how I am, I'm like, "I'm terrible, actually."
Exactly, exactly, and then but see, the issue is, now you put yourself in a position to have to respond to that, and what do I say? You know? So,
Give
I
me a
I don't
week and I'll be fine.
eh, you know what I mean? So it's like, just thinking about what we say, even to our
Yeah,
patients, I mean, let's go hand in hand, when you ask patients, when you talk to patients, just being mindful of the word choices that we use because we can take a situation and make it extremely worse, and sometimes it don't matter what you say, it's
yeah,
gonna go
it's
bad.
bad.
But
Yeah.
just being mindful of the word choices, I think is another important piece even in this podcast.
Yeah, I'm glad you brought that. This is what I love about organic conversations is we talk about what we are passionate about and what's heavy on our hearts now. And we met months ago. So what's on
Right.
your heart now is different than it was months ago. So that's what I love about this. And we try to prepare ourselves, but we just go off, and that's the story of my life. But
Yeah.
I notice, and just bringing that up, I notice in where I work I listen to, like, I work in the NICU, so families call in a lot because the babies are there for months, so it's not the norm for the parents to be there every day, all day, so they call a lot, and I'll listen to conversations that the nurses have for the updates for the parents, and sometimes I'm sitting there, like, cringing
Mhm.
because I'm like, "There's so many ways to say that without
Yeah,
terrifying them,"
yeah.
but what you're saying is terrifying.
Mhm.
And it's not even like a bad thing. Like, obviously, you have to have that conversation. One, it's not coming from me, it's coming from the doctor. But,
Right.
like, as a nurse, you're there to, like, help to facilitate what the scary medical terms the doctor says in a here's the English, basic version of
Right.
that, and let me try to make it less scary and make you understand. So that also is part of what nurses do, and we need to remember that. We can't just spew out medical terms to our patients that sound completely terrifying and expect them to be like, "I'm good."
It's so funny you say that because my wife actually got an email today about some follow-up testing. And
Okay.
she called me in to read it and was like, "What does this even mean? Why is he using words that I don't even understand?" And it's to your point, it's something that I think we have to be more mindful of in healthcare as a whole, is that some patients don't understand the terminology that we didn't understand before going to school. So
Yeah.
when we speak to people, just being mindful of the word choices and realizing that they don't have the training and or experience in most cases that we have, and that we can make it a terrifying experience just by using. It's like you go to a different country and someone is talking to you in a different language, and you're like, I don't know if they're happy or mad or sad because I don't know the words they're using. And so that's
Yeah.
something that I think we all have to or need to be more mindful of.
Yeah. I agree, and, like, I'm just thinking in my head, like, all these terms that is, in medicine, and I'm like, I learn a new term sometimes, like a disease process of a baby. I'm like, "I've never heard of this," So we have to it is our job, and I think that sometimes we forget that as nurses that we are the not facilitator, but we're that safe person to the patient
Mhm,
when because the doctor, obviously, they respect the doctor comes in, diagnoses, figures it out, whatever, and then they leave, and the patients look at us, and they're literally saying, "Help me," with their face and
mhm.
being like, "What does that mean? What does that mean for me? What does that mean long term for me?" And, I think that we need to remember that. And I'm so glad that this conversation went there because it is something that I witness is not as prevalent as it was,
Mhm.
when I started nursing. And we're so quick to just throw our education in their face where it's like, I don't agree with that. I'm a nurse. I know my stuff, but I also want you to understand it and you to be comfortable and trust me.
Mhm.
And, I think that yeah, I just love that we had this conversation because I think it's important to get back
Absolutely.
there.
I
Yeah.
totally agree.
Yeah, and no emails with crazy terms in it, that's insane. Now it's in writing, like, we can't even take it back.
Right.
Oh gosh. Well, I have really enjoyed this conversation. is there we kinda got off topic, but I'm glad we did because I think that this brought something really huge to the listeners. And, what is there anything about becoming a CRNA, being a CRNA that you really just wanna get out there, or did we kinda cover it?
As far as becoming a CRNA, I hear the terminology or the term imposter syndrome a lot. And I think that imposter syndrome is something that happens anytime you're branching out to do something, for lack of a better word, greater, right? You
Yeah.
can kind of
Mhm.
start to doubt yourself. You can start to think you don't belong or that you're not capable of being in these spaces. And for the people who have been accepted into school, one thing I want to tell them is that you have just been told that you're not an imposter because you were accepted, right? So, like, once you are accepted, there's no longer a reason to feel like you're an imposter because someone else told you that you weren't. And they weren't just saying that to be nice. Your
Yeah.
mother, your father, your family, they may be nice to you. These
Yeah.
program administrators, they're going to select you because they see and believe in your potential, right? So,
Wow.
that's
That
one.
just gave me the chills. That literally just gave because you feel that way. Like, you saying that, like, spoke to me because there are sometimes I'm like, "I can't do this." And, like, the person's like, "You can, and you just did it." and we
Absolutely.
doubt ourselves. Yeah,
Absolutely.
and that's I love that. I love that. Oh gosh,
Yeah,
you're so good.
and for those that are applying, just knowing that there are multiple factors that go into selecting a student, and that just because one school's criteria don't quite align with your package or presentation, that it's
Mhm.
okay that there is another school that you will meet those requirements, and just to not give up on your journey. There are so many variables to getting into school. And your goal is to just, one, don't be intimidated by the process. It may not look like someone else's because it is a non-linear path. And that if you are willing to pursue it, you will achieve it.
Yeah, I love it. I think that's a great place to end this. I don't I you you just you say you motivate me, and I'm not just saying that. Like, I'm listening to you, and I'm like hearing your words, and I'm taking that for myself too. And I appreciate you, and I appreciate all you've done. And I'm really grateful that you agreed to come on this podcast. I know you have so much experience not only in the medical field but also in podcasts. I'm new to this, so I appreciate you taking a risk on me and coming on here, but I really think your message is going to hit a lot of people, and I'm including myself, and I'm very grateful for it. So thank you.
No problem. I say I aspire to inspire, so this is the goal. So the fact that
Yeah.
you say that I'm a motivation to you and potentially others, I mean, that's the goal. And to also remind myself, you know, to keep going, to keep
Yeah.
pushing, to keep growing, to keep learning. And that's the goal.
Yeah, and you know what? Life's hard, and even y- there are days where you probably doubt, is this what I'm doing? But like, we need that reassurance, and this is your reassurance. I think that you have a lot more to give to nurses and everyone. Fire, EMS, paramedic, everyone. I think that you have that experience, and I hope your voice is heard by me, and I hope it's heard by many more. So thanks.
I appreciate it. Thank you.
Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.